The Nigeria Center for Disease Control has confirmed a diphtheria outbreak in Lagos and Kano states. NCDC says it has begun surveillance monitoring of the disease after the outbreak in Kano, where 25 people have reportedly died. The organization's Director General, Ifedayo, Adetifa, has urged healthcare workers to maintain a high index of suspicion for the disease by being vigilant and looking out for symptoms.
And the Director General of the Nigeria Center for Disease Control himself, Dr. Ifedayo Adetifa, joins us on the news tonight for the latest on this outbreak. Thank you so much for making out time for us tonight. Dr. Adetifa, let's begin by asking you what this diphtheria is all about. And clinically speaking, do we know why we're seeing them in this 2 states or 4 states, as you have highlighted in your press release today? And do they have the potential to spread to more states across the country?
Thank you. Thank you. Good evening, and thanks for having me. Well, diphtheria is a vaccine-preventable disease that used to be common decades ago. And due to the effectiveness of our childhood vaccination program, most people have forgotten what diphtheria looks like. So the fact that we're having a resurgence now suggests that there have been critical reductions in vaccination coverage among pockets of our population, and this reduced levels of population immunity has given rise to the cases that we are seeing. So it's not a matter of diphtheria spreading from state to state. Diphtheria, the bacteria that causes this disease, is present everywhere in our environment. And any state where you find diphtheria now, you're likely to find that this will be associated with suboptimal vaccination coverage, either in general or in pockets of the population. Back to you.
Right, great. Thank you very much. Well, you've been quoted as saying that you're monitoring this outbreak in about 4 states, including Kano, Lagos, Yobe, and of course, the 4th state. But what exactly are you finding out so far? Because as at the last count, based on what we are hearing, 25 people unfortunately have lost their lives. Is this really anything to worry seriously about? What are you discovering?
Well, as you've rightly said, there have now been cases of diphtheria reported in Lagos, in Kano, in Yobe, and now in Osun State. The Kano currently has the highest number of cases, and this is now closely followed by Yobe. Yes, there's been, at the time of the report, Kano had recorded about 25 deaths, but actually in total, at the moment, this week ending, I think they have been about 34 deaths in total now. While this is a highly preventable and very treatable condition, it's without the appropriate treatment, including antibiotics and something called diphtheria antitoxin for severely ill cases, fatality can be high. Otherwise, with early detection and prompt institution of the right treatment, the outcomes are typically very good. Back to you.
Great. And as you have said, Dr. Adetifa, this is clearly a failure of childhood vaccination in these states that we're seeing them. But do we also have the capacity to respond accurately to treat those who come down with diphtheria in this state? And what sort of support are you giving them at the moment?
Well, as I said earlier, diphtheria is actually a relatively easy condition to treat, in that it responds very well to a relatively cheap and commonly available antibiotic. The problem is for the really severe cases that require something called diphtheria antitoxin. The NCDC has prepositioned diphtheria antitoxin, and as in the first 2 states that cases were reported in, we had We have already shared since last year, actually, December, shared vials of diphtheria antitoxin for use in Lagos and Kano State. And we are also planning to extend those to every state where cases are found. The most important thing is that patients are recognized very early as a likely case of diphtheria, and we ensure that we have laboratory confirmation or clinical confirmation, start treatment, and then, of course, use diphtheria antitoxin as indicated. We have provided standard operating protocols for how the antitoxin should be used. We have provided support for states. Indeed, for most of December, we had rapid response teams in Lagos and in Kano, and we are keeping an eye on what is going on in the other states, and will provide support as may be requested, both off-site or by deployment of people where necessary to support the response, and of course, deployment of necessary commodities as well, where this is indicated. In addition, we coincidentally had arranged to have training for laboratory diagnosis of diphtheria, including testing for the toxin that is responsible for most of its clinical effects, and already hosted this week a number of laboratory focal persons, experts from across the country, including these states that are mentioned here. So I think we're in a good place to help states respond, but it is key that patients are recognized early, diagnosis is made quickly, and they are placed on the right treatment. And we have a bit of work to do in that space because, as I said, diphtheria has been so uncommon that we now have perhaps several generations of healthcare workers who have never seen a case before.
And how more complicated is this with seeming surge in COVID-19 cases? And when you look at the symptoms, they seem to be very, very similar. How do you then, decide that this is diphtheria and this is COVID? And within how much window do you have to actually treat and attack this disease?
Ngozi, please don't make connections that are not there. There's COVID, there's diphtheria. Yes, they're all respiratory illnesses that have similar symptoms: fever, runny nose, cough, sore throat, just like everything else. In the case of diphtheria, there might also be red eyes, conjunctivitis, and you may have gland swellings in the neck. In fact, the gland swelling, along with collection of fluid in what we call the subcutaneous spaces, that's under the skin, sometimes gives patients what we call a classic bull neck appearance. Okay, and then for those who are severely ill, they tend to have either a gray or white or grayish white patch at the back of their throat or even in their nostril. So these are some of the features that, of course, make this completely different from COVID. And then you are likely to see this in populations where vaccination coverage has really been poor. So our approach is to use MPHCDA data to look at places where coverage is quite poor, and to expect or alert states to keep an eye on those settings with the view of picking up cases early. So those that are at the highest risk, of course, are children and adults who never received vaccines, people who live in crowded environments, that's typical for respiratory illnesses, people who live in areas with poor sanitation. So again, there's a bit of equity or socioeconomic, low socioeconomic standing issue associated with this. And then we do have to keep an eye now that we are seeing cases on healthcare workers and others who are now getting exposed to suspected or confirmed cases of diphtheria. People with exposure can be given a course of the appropriate antibiotic to help protect them. And that is also quite effective. So these are the things that we need to bring together closely and at scale across all settings where there's an outbreak to bring things under control very quickly.
Thank you very much. Yes, we'll have to leave it there. Thank you very much. The Director General of the Nigeria Center for Disease Control, Ifedayo Adetifa. Thank you so much.